The Patrick administration is proposing legislation to scale back health benefits for retired public employees. 22 News State House reporter Christine Lee is standing by live on Beacon Hill, where public workers angrily oppose these changes.
The Patrick administration says health care costs for retired public workers are outgrowing the state's means. But public workers say a deal's a deal, and it would be unfair for the state to change their contracts. Governor Deval Patrick has filed a bill that scales back retiree health benefits for public workers. Patrick estimates that over time, the state and cities and towns will have to come up with more than $40 billion to pay for current retiree health benefits. The state's budget chief says that's money the Commonwealth doesn't have.
We have more retirees, health insurance costs are rising, and we're concerned that if we stay on the current track, we won't be able to sustain affordable comprehensive health insurance for our valued career public sector employees.
Patrick's bill would increase the minimum years of service required for retiree health care from 10 to 20 years. It would also increase the minimum retirement age to 50 for police officers and firefighters, 55 for ambulance attendants, and 60 for most other public workers. Unions are prepared to sue if these changes go forward.
When people get hired, they get hired under an employment contract, and this violates that contract.
Linda Shaw is a food stamp worker from Beckett. She's worked 8 years, almost long enough to cover 50% of her health care when she retires, unless this bill passes.
So this bill would cut my benefits and require me to work until age 75, and that makes me angry.
Workers' unions say the state needs to prioritize setting aside money for retiree health benefits, but the Patrick administration says that would take away from other important state investments like education and transportation. Live at the State House, Christine Lee, 22 News.